Tonight's broadcast, high blood pressure. Has it spiraled out of control? How many people are affected and what should we do about it? Special interview tonight with Dr. Sarah, a look into the role that the pharmacist plays and what you can do to treat and prevent high blood pressure. All tonight, exclusive coverage on NNSK 30 Minutes. Hi, thanks for joining us. Tonight, we will be addressing a serious problem plaguing 74.5 million people over the age of 20 in the United States. As a matter of fact, 1 in every 3 Americans is suffering right now from high blood pressure.
What is high blood pressure, you ask? Well, there are 2 stages. A person with normal blood pressure will have a reading of 120 over 80. A reading of 140 to 159 over 90 to 99 is stage 1 high blood pressure, while anything above 160 over 100 is regarded as stage 2 high blood pressure. So, does everyone that has high blood pressure know that they have it, and are they getting it treated?
The answer is no. Many people right now have high blood pressure and don't even know it. These statistics from the American Heart Association indicate that of all people with high blood pressure, only 67.9% were under current treatment, 44.1% had it under control, and 55.9% did not have it controlled.
And for these reasons, high blood pressure is often called the silent killer because it can be unrecognized for years and cause no symptoms, but may be doing progressive damage to your heart. These lead to disabilities and even death from heart attack, stroke, and kidney failure.
Now we'll get some inside information from a prestigious heart surgeon, Dr. Sarah, as she goes over the causes and risk factors of high blood pressure and how you can treat and prevent it. At the end of the segment, we'll show you some simple ways to get your blood pressure tested and talk with a pharmacist about their role in your health.
Good evening. Thanks for having me.
You're most welcome. Thanks for coming to talk to us about the serious condition affecting millions of people across the country. So first off, what makes a person more likely to develop high blood pressure?
Well, there are several factors that could lead to high blood pressure. For instance, older people, African Americans, and men are more likely to develop high blood pressure. Family history also plays a role. While these things cannot be controlled, there are several things people can do themselves to prevent this serious condition. The most prevalent of this is maintaining a healthy weight.
So things like nutritious diet and getting plenty of exercise work?
Yes, maintaining a healthy weight is key to keeping blood pressure under control. Obese people are 2 to 6 times more likely to develop high blood pressure than people whose weight is within a healthy range. Other lifestyle factors can influence your blood pressure, including smoking, alcohol intake, and excessive sodium consumption. Certain medications such as birth control and diet pills can also raise your blood pressure.
Wow, that's a lot of information. So if someone has high blood pressure, how do they know?
Well, if your blood pressure is severely elevated, you may develop headaches, dizziness, blurred vision, nausea, and vomiting, chest pain, and shortness of breath. But the simplest thing is to go get tested.
All right, thank you. And now cut to a clip of how you can get your blood pressure tested when you're out and about. We're here at your local pharmacy where you can take your blood pressure for free to see if you are at risk for high blood pressure. Our patient here will demonstrate how to use it. Step 1. Insert your left forearm into the cup up to the elbow. Palm down and press the green button to begin the test. Relax, but do not move or talk. Warning, if the pressure bothers you during the test, press the stop button to deflate the cuff and keep on pushing until the cuff deflates. Step 2. To clear the displays after the test, press stop. Your local pharmacy will also sell blood pressure monitors, so whether you're at home or traveling, you can check your blood pressure. Our patient here is not at risk for high blood pressure, as his reading is in normal range.
We just showed you how you can get your blood pressure tested when you're out shopping. And now, an exclusive interview with Stacy, a pharmacist in your local area.
Hi, Stacy. So you're a pharmacist at Wegmans. I was wondering if I could ask you a couple questions today.
Sure.
What do you think is the biggest concern for patients with high blood pressure?
Patients with high blood pressure, well, the problem with that is a silent killer, so most of the time you don't have the symptoms. But by the time you figure out the symptoms, it may be too late. So usually with blood pressure, you have it can cause heart failure, kidney problem, eye problems, and heart attack and things like that. So it can cause a lot of complications.
Okay. So how would you prevent high blood pressure, or if you already have it, how would you regulate it?
Are you talking about with medication or without? Without medication? You can change your lifestyle, like your diet, less sodium intake, increase your potassium intake and fibers. And then exercise, because the weight, if you're heavier, it's more stressful for your body to work. So then in return, it increases your blood pressure too. So diet, weight, stop smoking, especially women who are on oral contraceptive, and also taking birth control. And when they're young and smoke at the same time, it's a high risk. But that's pretty much it.
And if a patient is taking high blood pressure medications, how would you counsel them?
It's depending on what medication they take. For example, if they're taking an ACE inhibitor, the most common side effect is coughing. Most of the time, people can tolerate that, but if they can't, they can have other choices. And if like beta blocker, you have to be careful not to sudden withdrawal if you stop right away. It can lead to heart attack and things like that. But the majority of the blood pressure medication, most of them are contraindicated. So not everybody, but most of the drugs have that common side effects.
Okay. Thank you so much for your time.
Okay, no problem.
Thanks for watching NNSK 30 Minutes. We hope that you enjoyed watching our show.
Stay tuned next week for our special coverage on diabetes. And now, a local
Okay, well,
across the country. First off, what makes a person... Sorry, you're scrolling so fast.
I have to, it's so big.
It's so good.
Tran, who's going to talk to us about blood pressure and how it really sucks and how that's so cool.
They getting it treated?
No. Many people right now don't have high blood pressure and don't even know. Blah, blah, blah. Let's keep going.
Okay, that's good. But maybe doing progressive damage to your heart. There are lead?
Script problems.
There are
Okay.
We should have proofread this before.
I know, you guys need to.
high blood pressure. Oh god. Because there's a break, so I was thinking.
Okay, let me pressure than people whose weight is within a healthy range. I'm sorry, but we have to do this again
No, it's
anyways.
fine, it's fine.
Yeah.
Thanks for watching. Oh, sorry. I didn't see myself. So.
Normal range. I'm sorry.
Yeah.
Yeah,
Wait,
I'm
what's
sorry.
wrong with that?
Camera.
That can be modified. Okay, wait, let him talk. Go ahead.
Do I have to talk about?
You have to. You do.
Oh, I
Okay.
didn't
We're
know.
good. Can we do it here?
Hey. Is that loud enough?
Hi. Tonight, we will be